Susan Finley. She was a 55-year-old woman that worked at Walmart in Colorado. One day, Susan got pneumonia and had to call off work for several days. But when she returned back to work at Walmart, they had fired her for missing one day too many to fit the criteria of attendance. What does that mean for Susan? Well, unfortunately, this meant that Susan not only lost her job, but also lost all her health care benefits that went along with that. This meant that Susan could barely afford her rent and could barely afford her groceries to feed herself. 3 months later, Susan was found dead in her apartment from suffering from a severe flu. Well, you ask yourself, it's a flu. Can't you just go get to the hospital and get help? It's very treatable. Well, yes, but unfortunately, Susan didn't want to. She was barely scraping by and trying not to get evicted. She gets what appears as her basic cold or flu, didn't go to the doctor because she didn't want to risk spending money she didn't have, and the consequence was passing away. As I'm standing here giving this speech to you right now, there are thousands of people dying from not having access to health care all around the world. There are many causes to this, but the main ones we're suffering from now are resources, lack of money, and lack of health care providers. At least half of the world's population cannot obtain essential health services, according to the World Health Organization. Lots of countries are extremely limited to resources, which means they lack access to health care. In Yemen, Syria, they just had an outbreak of chloria. Well, what's chloria? I've never heard of that. Chloria is an infectious disease in the small intestines that is caused by infected water. So this actually affects millions in Yemen right now. Even though it is very treatable, thousands are still dying. They lack many essential resources such as food, water, and medical supplies. Also, unlike us, where there's hospitals and doctors' offices around every corner, the closest hospital to Yemen citizens is an hour, and the closest doctor's office is 30 minutes. So the International Committee of Red Cross states more than 80% of Yemen's population lack food, fuel, drinking water, and access to healthcare services. So in Yemen right now, they don't have a lot of access to water, so that means they're going to drink any water they find. We need water to live, right? But since their water's infected, they get sick, they don't have access to health care, they die. That's basically what's going on right now. The same type of things happening in Sudan as well. In Sudan, they're also lacking food, water, and medical supplies. 58% of the population can't afford the daily food basket, so how are they supposed to be paying for their health care? The Lancet states that 7.8 million people in Sudan are facing critical problems related to mental and physical well-being. They state the country's health system is ill-equipped to respond to growing and neglected needs. So nobody even cares to help the people in Sudan. This is also happening in Nigeria, unfortunately. They're suffering greatly from unaffordable healthcare, lack of resources, and lack of healthcare providers. Because of this, Nigerian citizens have suffered from infectious diseases outbreaks and chemical poisoning for several years. We've been neglecting Nigeria and neglecting to help them for several years, and people have been dying from something we can easily prevent. They also don't have food and water, so that means their immune system is being broken down, and they get sick easier, and they can't get better. And they also don't have health care to go to solve that problem. So other countries are struggling with access to health care. Well, how does that affect you? Well, 42% of people in America reported difficulty finding an affordable coverage, says the Commonwealth Fund. In order for most Americans to be able to afford health care, you need insurance. But insurance itself can be very costly. Many who cannot afford health insurance or hospital bills delay in getting health care, which can be harmful. Matter of fact, 37% of Americans delay getting healthcare because it's too much money. Besides not having money, we're lacking healthcare providers in general, and good ones at that. Healthaffairs.org states that by 2026, 11.6 million healthcare workers will be in need nationally, not globally, but nationally. This makes me wonder who's going to help me when I get sick, and how long will I have to wait to get the help that I need? Even though this seems like a big job to take on, there are always ways that we can help. First and foremost, you can go to internationalmedicalcorps.org to donate. The International Medical Corps are working with countries like Syria and Sudan, and they actually create medical facilities to help people in their country and also provide them resources to help them get better. In America, there are also many GoFundMe fundraisers that you can contribute. And there's a lot of medical-based ones where people need procedures that can change their life, and you can donate to those as well and help them get better. So also for doctors and healthcare providers, you guys can actually go to low-income areas, provide really cheap clinics or even clinics for free to help those people that can't afford healthcare. Also, holding job fairs in local high schools to help guide students and help them decide if working in the medical field is for them can actually get people in the work field. I actually know that from my own personal experience because I was in the health academy at Deltona High School. Matter of fact, 98% of my class graduated with their industry certifications. And a lot of them are trying to get into the health field right now, or in college for nursing, or college for doctorates and things like that. So these kind of things actually do work and actually get students' minds working and thinking, maybe the medical field's for me. But if we don't step up and help, people will continue to die or be critically disabled for the rest of their lives and devastate not just them, but their friends and family as well. I want you to think to yourself if this was you or someone you loved. It is very possible that one day you can be in one of these situations, and wouldn't you want the help that you deserve? There are millions suffering from lack of healthcare all around the world, from unaffordable healthcare, lack of resources, and just lack of skill in not having healthcare providers. But donating and helping not just the people of our country, but others as well around the world can show drastic improvements in our healthcare system globally. Thank you.